Doctors have read it. What was the most shocking case of "oh, I thought that was normal" you've seen in a patient? MD here. Had a patient come in for cast removal literally years after it had been put on. She had just decided it wasn't worth taking off. Her leg skin was literally growing over the top of the cast and then down it. Once we finally cut the cast off, she was surprised to find that she had no skin underneath, but the dead tissue over her muscles and bones was being cleaned by about 300 maggots. I knew by the smell that something under there wasn't right, but wasn't expecting that. Patient seemed completely fine with it. Whatever. My grandfather was a stubborn old-time chicken farmer, had many health problems. He wouldn't take a shower because he couldn't lift his legs over the tub. His legs would swell up and crack, and because he didn't take a shower, maggots moved in. He would collapse, be taken to the hospital, and they would clean it out. And a few mothers later rinse and repeat. He wouldn't accept help, or remodel the house or anything. Nurse here. Guy probably went to the where they props did a CT scan of his abdomen and pelvis. Probably did a paracentesis, removal of abdominal fluid using a needle, to reduce his abdominal swelling. Blood tests to check liver enzymes, electrolytes, blood counts to check for infection, and also, acetaminophen, Tylenol, level to check for toxicity. A thorough history to check for excessive alcohol consumption which may cause liver cirrhosis. Agree with other poster who said liver failure is a long circling of the drain. A brutal death I wouldn't wish on an enemy of mine. When I was a med student, we visited a clinic in the country where I studied. Lots of people get horrible injuries, and use the local elixir of dirt, motor oil, spit from the local old lady, to patch up an exposed arm bone, or whatever. Had one woman in her 20s come in with a fungating breast cancer that looked like a hard mushroom mold growing through the skin and to the outside world, constantly bled anytime you touched it. Her family shamed any injuries or impurities, and she thought she just needed to keep it covered until it got better. Unfortunately, I have seen this on 2 occasions. Both at hospitals that were in middle to upper class communities here in the US. One was a 40-year-old woman, a successful business owner and fully insured. Her sister made her go to the because she cared of CPE. She was asked to put on a gown for an EKG. I will never forget the cider odor of her breast. It literally looked like green hamburger. Sadly, she did not seek care sooner, because she said she was embarrassed by the appearance and later the odor. I followed her care as best I could. She went through bilateral mastectomy, radiation TX and chemo. She survived another 3 months of hell before she passed away. The second patient was a 28-year-old mother of 2. No insurance and had to work to feed her family. She was seen for a care of neck pain. Physical exam X-ray revealed both breasts to be full of tumor. I know she had a double mastectomy and I lost track of her for some time. Approx. 2 years later, I ran into her at our kids' gymnastics meet. She was in remission and doing really well. Not a doctor, but a patient. I went in for thigh, hip pain. I couldn't lie on that leg for more than 30 seconds without pain. I thought it was muscular, and my doctor thought it might be radiating back pain. I had several x-rays and learned I had broken my hip sometime in the past, had a floating bone chip in my hip, degenerative disc disease, a birth defect in my spine, and mild scoliosis. I don't know if this fits, but here's a story about my husband. We were messing around and he chased me through the kitchen, took a hard left turn and lost his footing. Fell on his side. He's a big dude, so falling is a bit more traumatic for him. He couldn't put pressure on his leg and knew immediately he was hurt pretty bad. He was able to crawl to the couch, and once settled said he wasn't in too much pain. He decided to sleep on the couch that night so he wouldn't have to go upstairs. We made an appointment in the morning for the so we wouldn't have to sit there all day, but they didn't have an opening until 2, so we just hung out at the house. He was in a decent amount of ambient pain, but it didn't seem emergent. Once we got to the hospital, we find out that he had broken his hip, in this case breaking off his entire ball joint from the top of his femur. The nurses said they couldn't believe that he was able to sit up and had slept on it, implying that we should have come the night before, and probably by ambulance. It required surgery with some hefty bolts to put it back into place. But the crazy part is that apparently a healthy 30-ish-year-old man breaking his femur from standing is highly unusual. After several tests and an MRI, it turned out he was in the early stages of osteoporosis, due to a pituitary tumor in his brain. So, we discovered a benign brain tumor all because dude was wearing slippery socks. Patient here. Went to the doctor for a note to have a day off work since I didn't feel great and just didn't want to work. Doctor poked me in the stomach, said, "That's not normal," and sent me off to have a scan, which took me 2 months to get around to. 2 weeks later I get a letter from the doctors asking me to come in. Change my shift, so I go, and the doctor went off at me for not coming in sooner, and told me to go home and pack a bag. I'm off to the Royal Brisbane, it might be cancer. More scans later and it's decided that it's not cancer, it was a 4-kilogram cyst. My only symptom was an enlarged stomach and the "you're getting fat" comments from my mother. Not a doctor but have a story. My oldest son was 11 years old and needed a physical for youth tackle football. We had a new doctor, so she went into more detail than most physicals. He had complained that his ankle hurt during the middle of baseball season, so she asked if he could take off his shoe. When he did, she immediately points to the side of his foot where there was a strange bump and informed us he had a broken foot. I didn't believe her as I pointed out he had the same thing on his other foot as well. She took a look and said, "Oh, he has 2 broken feet," and sent us over to get x-rays from the hospital. I was laughing, thinking this was so crazy, believing there was no way my son, who not only finished playing in a baseball tournament, but who was running and jumping at the swimming pool literally an hour before, had 2 broken feet. After the x-rays were completed, my smile quickly faded as the doctor was right. That is when we learned about completely flat feet and the damage stress fractures can do when they go undetected. 8 weeks of cast and special shoes and insoles for the rest of his life solved the problem. His feet are still deformed, but it never slowed him down. I was the patient. Got a new body, my 4th, due to moving several times, and went for a checkup. Braced myself for the horrible pain and winced as soon as the speculum touched me. She immediately stopped, and as it turns out, extreme vaginal vulvar pain isn't normal. But I just had 3 boggies who apparently deaf that I nearly cried in pain every time I was checked. Because several people in comments have asked, my doctor called it vulvar vestibulitis, and said it's called a bunch of different things, that the name gets changed every few years. I think the term most used now is vulvodynia. No known cause, maybe too many nerve endings in the area. Definitely bring it up to your doctor if you are experiencing this. From what I know now, some discomfort is normal, but the knife-like pain is not. I am doing somewhat better now thanks to some physical therapies and a lidocaine ointment I can apply beforehand. Also, if you think you may have this and need to find a new doctor, I recommend finding a woman, and the younger the better as education seems to be improving. And talk to them before they touch you, and if they dismiss your concerns, find someone else. You don't need to worry about offending them. This is your body. Your health is more important than a doctor's feelings. If you have trouble speaking up for yourself, like I do, take a trusted person with you to help advocate for you. When I was a medical student, a patient and his brother came in together. Patient was just a post-op visit after a hernia repair. Found out he had another, baseball-sized hernia. His brother, on the other hand, had literally had a football-sized hernia visibly coming out of his left leg of his shorts. Looked like an inguinal hernia, and he was able to use it as an armrest. I asked him if that bothered him at all, and he straight up said, "My brother's hernias were painful, but this isn't, so I thought it was just a quirky defect." I hope he was lying to save face, but we recommended he get it taken care of. Resident doctor here, although not an obgyn. In my obgyn rotation in medical school, I had a patient who was a first-time mother having difficulty nursing her baby. The patient said she had some redness, and it had been hurting to nurse on one nipple, so she often had to switch until finally it became unbearable for her to nurse from either. She had mentioned that she thought her nipples might be cracked or chafed. When it finally came to the exam, she had the most chafed nipples I had ever seen. It looked totally raw and macerated to the point that they looked like 2 large pepperoni slices. One of her breasts also looked like the wound had led to mastitis. It definitely led to a new appreciation of how difficult breastfeeding can be on new mothers. Work at a dentist's office. Patient presents for an exam. Concerned part of her tooth has chipped off. On examination, it is not in fact a tooth that chipped off, but rather a piece of calculus, which is built up of hard tartar that covers your teeth over time when you don't brush them. It can be small deposits, or in this case, an entire bridge covering her actual teeth. She thought the calculus was tooth material, and was quite shocked to learn we were actually unable to see her real teeth, and she'd need an extensive cleaning to remove it all. Not a doctor, but I was rushed to the ER when I was 23. When I got there, I was admitted as an undiagnosed type 1 diabetic. I thought this was normal bit is that, while living undiagnosed for about a year, I dropped 80 to 100 pounds. I weighed 120 labs and was as weak as I was frail. I had stopped going to the gym months beforehand, so I just thought, well, I was as skinny as a kid. Makes sense I would get this small if I stopped eating and working out. I'm making my internship, and one night I was attending a triage at ER. Triage is the area where you check the patients and decide how urgent is the attention they need. Context here, I'm in a third world country, and I'm at a public hospital that attends uncovered population, and instead of one hospital with all the specialties we have three, the main one, the gyno hospital, and the children's hospital. So, I had this woman of late 30s, she started telling me that she had an extreme pain, 10 tenths, in the lower abdomen, no other sign that food could be involved, neither kidney stones or urine infection. I proceed to ask about last menstrual cycle. She doesn't recall the exact date, but she says that was like 4 months ago. Without hesitation and without asking more or anything else, I told them, she and her familiar, to go right away to the hospital that was crossing the street, because if it was something obstetric, we didn't have any gyno in this hospital, and if it was something of general surgery, they had general surgeons there. We got a call like 20 min later. Lol, that woman delivered her baby at triage of the other hospital. Psychiatrist here. One of my first patients was a female college student that couldn't sleep because of the voices that constantly talked to her, and she felt forced to answer them at all times. From what she was saying, I gathered that depending on the particular voice, with name and identity, she was either cautioned about some people or situations or outright pushed towards violent acts. Her voices appeared when she was 16 if I remember correctly, and we've met when she was 20. So, at that point for 4 years of her life, she believed that it was normal to have such voices in your head, because, as she explained, many people talk to themselves. To some extent she was right, but I had to explain to her that they really talk with themselves is, that there are no other identities in them, but only an internal dialogue to clarify or resolve issues that bother them in their own privacy, so to speak. She was later diagnosed with schizophrenia. Patient thought I was dehydrated after a stomach bug. Called the doc and was frustrated. They recommended the ER in case I needed IV fluids. Left work mid-morning and told my boss I'd be back after lunch. Did a CT scan and turns out it wasn't the stomach flu. I'd had an ovarian cyst rupture and had a grapefruit-sized mass of internal bleeding clotting, and was anemic to the point they talked transfusion. I was admitted for emergency surgery to remove the blood and stop the bleeding. They also removed my left ovary, which pathology showed had torsion. Patient here. My psychiatrist saved my life. I have always had heavy irregular periods, so when I had bleeding that didn't go away for a month, I pretty much just kept on keeping on. Eventually a doctor referred me to an emergency department because of the constant blood loss. I got told, it's because you have endometriosis. So, for 5 months I had a heavy period, with doctors just dismissing it. Eventually my roommate called an ambulance when I passed out in the shower. The doctors did a blood test, and I was admitted overnight for a blood transfusion. Fun fact: blood transfusions make some people nauseous, which is not a fun way to find out you're allergic to an antiemetic. A few weeks later, at about the 6-month mark, I drove for an hour for my regular appointment with my psychiatrist. He took one look at me and told me proceed directly to the emergency room, do not pass go. So, I did, and was promptly admitted to ICU with a bilateral pulmonary embolism. I was hours away from suffocating to death. Turns out all the birth control that the original doctors had been giving me to shut me up and get rid of me had caused mass clots. The doctor that looked after me and ultimately saved my life wrote a paper on why it's stupid to ignore an gravida, never pregnant woman in her mid-20s with severe dysfunctional uterine bleeding. This will probably get lost, but it needs to be told. I'm a nurse, and one day another nurse asks for my help putting in a urinary catheter on a patient. I walked into the room to see the biggest ball sack I have ever laid eyes on. I'm talking as big as a basketball. The other nurse couldn't get the catheter in because she simply couldn't find the penis and urethra hiding under all that ball sack. I open a new catheter kit, start poking around in there for about 15 minutes, still no urethra to be found. Urology was called in to place the catheter. Anyway, I get talking to the patient about how in the actual fuck this happened, and why he waited this long to come in. It had been swelling for months. He was a computer programmer who barely left his bed. Even worse, his fiancée was standing next to him the whole time. Neither had thought that he might have needed to go to a doctor or the hospital when his ball sack started swelling months before. Needless to say, it was infected as shit.